Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system, then try to take actions to make a better system for all of us. Before we get started, we have a lot of topics today. We have gun control, we have Project 2025, and we have antitrust behavior and workplace intimidation. Before we get to them, down below in the YouTube description box is the link to the Healthcare Advocacy newsletter on Substack. You can go there, join for free, get this stuff delivered to your inbox every day. I would also point out that all of the references and news stories and links to published medical journals and actions, they're all in that newsletter. Okay, so let's get started. First, I want to talk about United Health. 10 years after Optum United Health bought Connecticut's ProHealth Physicians, the primary care network, it has become a mere shadow of its former self. When United Health bought the practice, it promised to take a hands-off approach, but they didn't. And here are the results. Doctors are retiring earlier than planned, or they're leaving and going to work somewhere else. Patients with serious medical conditions struggle to make appointments because they don't have access to the specialists who need to treat them, and others complain of mysterious diagnoses popping up in their charts. Patients are the customers, and they vote with their feet, and they are leaving. Now, over the past 20 years, United Health has brought some 90,000 physicians, about 1 in 10 in the United States, under its control, and it has leveraged this volume of physicians, along with its position as the largest Medicare Advantage insurer, to maximize profits. Now, STAT did an investigation, that's a medical newsletter, into this particular purchase. They spoke with about 15 former doctors, current and former ProHealth patients, experts in corporate medicine. They reviewed documents that were obtained through public record requests, and they reported that what's happened at ProHealth is pretty much the same as described by doctors at least 5 other primary care practices United Health has purchased around the country. Here's what United Health did, according to that report. Corporate managers pushed doctors to add diagnoses to medical records that would make the patients appear sicker and justify higher payments from Medicare, as it's between $600 and $800 a month higher payments. Doctors' concerns were addressed with, get this, skepticism, condescension, and retaliation. No wonder they're leaving. I'm still back at the 10% of doctors working for United Health. I had no idea. This is on the verge of a monopoly. Now, by the way, I want to point out the Department of Justice is now investigating the merger of Optum and United Health for antitrust violations. So that's good. And there's a link, I believe, in the newsletter to the Justice Department report on that. What's the takeaway? When the object is not care, but is a vehicle to generate cash for investors, patients suffer and doctors suffer, and this is evidence of that. Let's talk about Project 2025 and health, and this is not the first time we've done this, but it's new data. Project 2025 is the right-wing playbook for another Trump presidency. It was written by Trump appointees and the Heritage Foundation. It criticizes the Department of Agriculture as a major welfare agency. Now, I have a link to Project 2025 to the PDF in the newsletter. You can go there, and if you want to follow along in that hymnal, go to page 323. It takes issue with the agency's long-standing nutrition programs that help feed millions of low-income Americans every year, including pregnant women, infants, and K-12 school children. It outlines policies that would substantially cut Supplemental Nutrition Assistance Program, the SNAP program, formerly called food stamps, and the Supplemental Nutrition Program for Women, Infants, and Children, often called WIC, W-I-C. It would also shrink federal support for universal meal programs in schools that so many kids rely on. The proposal to restructure the Department of Agriculture builds on a previous Trump-era proposal, and of course there's a link to it in the newsletter, that would consolidate federal safety net programs. This included moving SNAP and WIC, which it rebranded as welfare programs, a term often used pejoratively, from the Department of Agriculture to HHS, to Health and Human Services. It's a move that experts pointed out would be likely made so that those programs would be easier to cut, including by designing them as welfare benefits deemed unnecessary by so-called conservatives. I hope I made that clear. So they want to move them from USDA to HHS, call them welfare programs, and then say, we don't need welfare programs. In fiscal year 2023, the Supplemental Nutrition Assistance Program served an average, 42.1 million people a month. That's about 12.6% of the U.S. population. However, the number of people receiving SNAP benefits varies dramatically by state. Some states, people have more income than they do in others. In Utah, it's very low, 4.6% of the people. In New Mexico, incredibly high, 23.1% of the people in New Mexico get food assistance. Look, removing the programs is not the solution. Removing poverty is the solution. There are proven strategies that work. Employment opportunities with health care makes a huge difference. How about solving the problem and not punishing those people who are evidence of the problem? Okay, here's an extra credit action for you. If you have extra time on your hands, I recommend it. Call any elected representative and tell them to fix the poverty problem, not the evidence of the poverty problem. I'll put a link to how you can reach them quickly. It's at usa.gov/elected-officials. You put in your address, it'll tell you who your officials are. You can call them up or shoot them an email. Let's talk about gun violence. Another school shooting in Georgia by a teenager with an AR-type weapon. It leaves society with this decision. If we do nothing, this behavior continues. I don't know what else to say. We've done nothing, and we have another school shooting. Gun violence is the #1 killer of children and teens in the United States. Not hunger, not disease, it's guns. It is a public health hazard and has been identified as such by members of the Biden administration, by at least one agency official. Here's a collection of data on gun violence that you can peruse. I've included it in the newsletter. You can go and look at it. A thing to point out is that the number of mass shootings is going up in the United States. None of the data in that list that I present to you are good. What's needed are ways to keep people who are acting out from having a gun. There is no need in the United States to have a weapon of war at home. Nobody needs a gun that can shoot 100 shells a minute at twice the force of a normal rifle. You just don't need it. What we need are safes to put weapons in, trigger locks, mandatory training, licensing, and registration. And here's my favorite. Make people who have guns have insurance. Then make sure that there are enough ATF, alcohol, tobacco, and firearm agents to go and enforce the rules. We need to let our elected representatives know that the current situation is not acceptable and we need them to take action. You can use ResistBot on your cell phone to send a text message to 50409. And here's the message. Sign, SIGN, space, PSEWBG. Sign, PSEWBG to 50409. Here's the message you'll send. Of course, you can use it as a template and call your representatives or email them if you want. I'm your consultant, and I don't know about you, but I am fed up with gun violence in our country. As you know, another school shooting with an AR-type rifle at a school in Georgia this week, and more dead and injured. We deserve to live in a country where we and our families can go to school or work and do it safely. What part of having 5-year-olds involved in active shooter drills makes you feel good? Look, it is way past time for we the people, that means you in Congress, to get in gear. No weapons of war allowed in homes. Nothing that can make a gun shoot dozens of rounds a minute like a machine gun is needed. Mandatory in-depth background checks on every gun transfer. Mandatory training and licensing and insurance. I want you to demand safe storage and trigger locks and red flag laws. You get the picture. Elected representatives have successfully blocked all of these. And when you block them, what you get is dead children. I've had enough. I want you to engage and get those laws passed and start protecting the public. And while I've got your attention, how about sufficient funding for enough alcohol, tobacco, and firearm agents to actively enforce good regulations that we've been discussing? I'm going to watch your words and your behavior, and I promise you, I will remember how you behave, and I will vote accordingly. That's what I've got for you. Down below, you can like, share, subscribe, send me a comment. I will get back to you, I promise. You can also send comments and requests for research to healthcareadvocacy1, all one word, @gmail.com. Thanks so much. Have a good evening.